Most men start their day with a cup of coffee. But what if I told you that what you don't do for your penis every morning might be silently affecting your energy, your confidence, even your ability to go to the bathroom with ease? Hi, I'm Dr. James Ellison, a urologist and men's health specialist with over 30 years of experience helping men, especially those over 60, reclaim their vitality and protect what matters most, their independence, dignity, and health. You see, the penis might seem like it's just along for the ride in your golden years, but in reality, it's one of the clearest signals of your overall health, especially heart health, prostate function, and even early signs of diabetes. And the first few minutes after you wake up, that's when it's talking to you the loudest. In this video, I'm going to walk you through 7 specific, practical, doctor-approved steps you can take every morning to care for your penis so you can boost circulation, prevent long-term damage, stay sexually healthy, and feel more in control of your body. And stick around for number 6. Most men skip this one, but it's actually where we see the earliest signs of trouble. If you catch it in time, you could add years of better function, confidence, and comfort. Before we dive into these essential tips, make sure to hit the subscribe button and turn on the bell. That way you won't miss any future advice designed specifically for your health and well-being. And if you find this video helpful, just type 1 in the comments below. If not, type 0. Your feedback helps me serve you better. So alright, let's get into it. Here's the very first thing every man over 60 should do for his penis the moment he wakes up. It's simple, takes less than a minute, but can make a big difference. One morning inspection. Look before you go. This might sound simple, even strange, but it's something I've told every one of my patients over 60. Take a moment to look at your penis in the morning, not with judgment, not with shame, just attention. I know it can feel awkward at first. We grew up in a time when men didn't talk about these things, but I've spent over 30 years as a urologist, and I can tell you some of the most serious conditions I've diagnosed started with nothing more than a quiet observation during a morning routine. Infections, minor skin irritations, even early signs of cancer often show themselves long before pain ever begins. Redness, swelling, small bumps, or unexpected discharge. These are not just cosmetic issues. They are signs, warnings, and if you catch them early, the chances of treatment being simple and successful skyrocket. One of my patients, George, 67, noticed a patch of dry skin that didn't go away. He mentioned it.
During his checkup, turned out to be something we caught early and treated quickly. If he hadn't looked, if he'd waited, things could have gone very differently. And if you're uncircumcised, it's even more important to gently retract the foreskin and check underneath. Don't rush through it. It's just a few seconds of your morning. Think of it the way you'd check your oil before a road trip. It's not a chore, it's smart. Preparation, respect, not fear. Care, not discomfort. This one habit is easy to overlook. But once you start doing it, regularly, it becomes second nature. And the truth is, the more familiar you are with your body, the faster you'll notice when something's off. But that's just the beginning. What you drink before you even reach the bathroom can make a surprising difference in how your entire system functions, especially below the belt. Let's talk about that next. If you're still watching and finding these tips valuable, go ahead and type the number 1 in the comments. Just so I know you're here and taking this journey with me now, let's move on to the
second essential step. 2. Hydrate. First, urinate. Second, for most of my life. Even as a doctor, I used to wake up and head straight to the bathroom without thinking twice. It was a habit. You feel that pressure and your body says, go now. But over the years, working with thousands of older men, I began to notice a subtle but important pattern. The guys who stayed sharp, steady, and had fewer urinary issues as they aged all shared one quiet habit: they reached for water before they reached for the toilet. It might seem backward at first. Sensage, drinking water when you already need to go. But here's what's happening behind the scenes. After 7 or 8 hours of sleep, your body is naturally dehydrated, your blood gets a little thicker, your circulation slows down, and your kidneys are trying to do their job with limited resources. That first glass of water helps wake up your system gently. It signals to your body that it's safe to flush out the waste, and more importantly, it helps your pelvic region rehydrate and get blood moving where it needs to go, including your penis. I've had patients tell me they started this one small habit and within weeks noticed improved flow, less straining, and even better morning erections. It's like priming an engine. You wouldn't run your car dry after a long cold night, so why do it to your own body? I usually keep a glass of room temperature water on my nightstand, that way before my feet even hit the floor, I'm already giving my body what it needs. Try it. You'll be surprised how quickly your system starts responding now that your body's waking up on the inside. Let's talk about how to
get your blood flowing on the outside, and no, you won't need a treadmill or gym shoes for this next one. 3. Do the 60-second warm-up stretch. I used to think stretching was for athletes or yoga classes, something for the younger crowd. But as the years passed, I began noticing how stiff my body felt each morning. Not just in my back or knees, but deeper in the way my blood moved or didn't move. I realized that a little movement, first thing in the morning, didn't just loosen my joints, it helped me feel more present, more
alive. And most importantly, it supported circulation where it matters most for men, the pelvis and groin. The truth is, your penis is a vascular organ. That means it depends heavily on blood flow to stay healthy and function properly. And when you've been lying still for hours, especially as we age, the circulation to your lower body slows to a crawl. One of the easiest ways to fix that. A light stretch, just 60 seconds. You don't need to touch your toes or break a sweat. I like to stand next to the bed, breathe in deeply, lift my arms and slowly twist side to side. Then I lift one knee at a time, gently, like I'm marching in place. It gets the blood moving, wakes up the nervous system, and gives your lower body the gentle stimulation it needs to support healthy erectile function and urinary control. Many of my patients are surprised by how much better they feel just doing this for a week. They report stronger flow, fewer trips to the bathroom, and even more confidence starting their day. And it makes sense. When the engine gets warm, it runs better. Now that we've got the blood moving, there's one morning signal that gives us a powerful glimpse into your health. One most men notice, but rarely understand. Let's break it down next. If you're still here, and these insights are speaking to you, drop a number 1 in the comments so I know you're following along. Let's keep going. Point number 4 is one that many men overlook, but it can reveal more than you think. 4. Check your morning erection and what it means. I'll be honest with you. This is the part where most men either get uncomfortable or make a joke and move on. But I want to tell you something as someone who spent decades working with men just like you. Your morning erection is not a joke. It's one of the most honest indicators of your overall health, especially your heart, your hormones, and your nerves. You don't have to write it down or obsess over it. Just take note. Did it happen today? Was it as firm as it used to be? Did it fade quickly or linger like it used to? That's your body talking to you when you wake up with a healthy erection. It's a sign that blood flow is
working, testosterone is circulating, and your nervous system is intact when that signal goes missing. Especially over a period of time, it could mean something deeper is going on. I remember one patient, Ray, who was 72, and hadn't had a morning erection in over a year. He figured it was just part of getting older, but after we ran some tests, we discovered he had early signs of cardiovascular disease. We caught it before it turned into something serious, all because of one silent symptom he nearly ignored. I know this isn't easy to talk
about, but I also know that when men start paying attention to this one signal, they feel more in control, less like they're just aging, and more like they're taking charge of their health. Now let's move from what you notice to what you actually do. Because what happens in the shower each morning could be helping or quietly harming you more than you realize. Let's talk about that next 5 clean but not too much for years. I believed a good strong soap and a hot shower was the best way to start the day clean and fresh, and I didn't think twice about scrubbing every part of my body like I was washing the car. But as I got older and after seeing hundreds of cases in my practice, I realized something important when it comes to the penis. More isn't always better. In fact, being too aggressive with cleanliness can cause more problems than it prevents. The skin around the penis is thin, sensitive, and protected by natural oils and bacteria that keep it balanced. Harsh soaps, hot water, and scrubbing can strip that protection, leaving it dry, irritated, or even cracked over time. This can lead to infections, rashes, or discomfort that feels like it came out of nowhere. I've seen many older men come in with redness or burning, thinking something serious was wrong when really it was just from overwashing. Now, I simply recommend using lukewarm water and a mild unscented soap if you're uncircumcised. Gently retract the foreskin and rinse underneath. No force, no rush, just like brushing your teeth. It's not about how hard you do it, it's about doing it the right way with consistency and care. There's a quiet dignity in treating your body with respect. These moments of care in the shower, done with attention rather than autopilot, can set the tone for how you treat yourself the rest of the day, and when you care for yourself without shame, it changes the way you walk through the world. But what happens next when you sit down to eat can either support everything you've done so far or slowly start to undo it. Let me show you what a penis healthy breakfast really looks like. It might surprise you. 6 fuel with a penis friendly breakfast. I didn't grow up thinking much about breakfast. Like a lot of men from my generation, I reached for whatever was fast and familiar: eggs, toast, maybe a few strips of bacon if I was feeling lucky. It wasn't until later in life, both as a doctor and as a man getting older myself, that I began to understand just how powerful that first meal is, especially when it comes to protecting sexual and urinary health. What you put on your plate each morning has a direct effect on your hormones, your blood flow, and even the health of your prostate. And the truth is, the
Standard American breakfast loaded with processed meat, sugar, and refined carbs isn't doing us any favors. Foods high in saturated fats and sodium can reduce testosterone levels and make it harder for blood to circulate properly, especially to sensitive areas like the penis. These days, I start my mornings with a bowl of oatmeal topped with walnuts, chia seeds, and a handful of blueberries. Sometimes I'll add a hard-boiled egg or a slice of whole grain toast with avocado. This kind of breakfast gives your body the nutrients it needs, like
omega-3s, antioxidants, nitrates, and zinc to support erections, energy, and long-term vitality. One of my patients, Thomas, 68, made just this one change for a month and came back to me saying, "Doc, I didn't know food could make such a difference down there." But it can, and it does. So if you've never thought about what your penis wants for breakfast, maybe it's time to start, because small changes at the table can lead to big changes everywhere else, now that your body is fueled and ready. Let's tackle a habit most men don't even realize is slowly working against them, and it all starts with where and how long you sit. 7. Sit less, move more. I remember the first time I really noticed it, how stiff my hips felt after a long breakfast, just sitting and reading the paper. I didn't think much of it at first, but day after day, I began to feel more tension, more sluggishness, and even some numbness in places I hadn't expected. That's when I started digging into the connection between sitting and men's health, and what I found changed my daily routine for good. You see, when we sit for long periods, especially in the morning, when blood flow is already slower from a night of sleep, we're putting pressure on the pelvic floor muscles and restricting circulation to the lower body for older men. This lack of blood flow doesn't just affect comfort. It affects erections, urinary control, and long-term tissue health. It even raises the risk of pelvic floor dysfunction, something most men don't hear about until they're already dealing with symptoms. What helped me and many of my patients was surprisingly simple. I started setting a timer to get up and walk for 5 to 10 minutes after breakfast. Not a workout, Just a gentle stroll around the house, out to the mailbox, or even down the hallway and back. It sounds small, but it wakes up your circulatory system, reduces pelvic congestion, and helps everything down there work the way it should. One man told me, "That little walk made me feel like my old self again." Gee, and I believe him because I felt it too. We weren't made to sit still all day. Our bodies are designed to move, and that movement helps preserve strength, function, and dignity well into our later years. Now, if you've made it this far, I want to leave you with something deeper, because there's one more layer to all of this that we haven't talked about yet. It has nothing to do with your body and everything to do with how you feel inside. Let's wrap this up the right way. Final words from Dr. Kara. If you're still here with me, I want to say thank you, not just for watching, but for caring about yourself enough to listen. That's the part no one really talks about for a lot of men, especially in their 60s, 70s, and beyond. The idea of paying attention to your body, especially your penis, can feel uncomfortable, even unnecessary. But the truth is, it's one of the strongest, most self-respecting things you can do. Each of these 7 habits we talked about, starting your day with a quick inspection, drinking water before you urinate, stretching to get your blood flowing, paying attention to your morning erection cleaning, gently eating with intention, and simply standing up and moving. These aren't big, flashy medical procedures. They're quiet, simple acts, but together they send a message to your body that you're still here, still paying attention, still invested in your health. I've sat across from hundreds of men who thought it was too late to change or too awkward to talk about these things, and I've watched them regain strength, improve function, and rediscover a part of themselves they thought was long gone, not because of some miracle drug, but because they started listening and they started caring. You don't have to be perfect. You don't have to fix everything overnight. But if you start small and stay consistent, your body will respond in ways that may surprise you. Your health, your confidence, and your sense of control are all still within reach. You just have to decide that you're worth the effort. If this video spoke to you, I invite you to share it with a friend or leave a comment below. Let me know which tip stood out the most and what you'd like to hear more about in the future. Because your story matters, and it's never too late to write the next chapter. If this video helped you in any way, please give it a like. It lets me know this content matters. Share it with a friend, a brother, or someone who might quietly be dealing with the same concerns. And I'd love to hear from you in the comments. Let me know which tip you'll start using tomorrow morning, or ask me a question. I read every single one. Don't forget to subscribe and turn on the bell, so you never miss new advice made just for your health, your confidence, and your quality of life. You're not alone on this journey.